Cordarone tablets is used to treat certain types of serious, possibly fatal irregular heartbeat, such as persistent ventricular fibrillation, tachycardia. It is used to restore normal heart rhythm and maintain a regular steady heartbeat. Active ingredient amiodarone hydrochloride. Amiodarone is known as an antiarrhythmic drug. It works by blocking certain electrical signals in the heart that can cause an irregular heartbeat. Indications. Cordarone is indicated for the treatment of documented life-threatening recurrent ventricular fibrillation and life-threatening recurrent hemodynamically unstable tachycardia in adults who have not responded to adequate doses of other available antiarrhythmics or when alternative agents cannot be tolerated. How to use. The dose should be adjusted on a case-by-case basis. The usual dose is as follows. At the start of treatment, load and dose 3 tablets daily for 8 to 10 days. Then the following days, maintenance treatment, half to 2 tablets daily. You should take the tablets with a small amount of water oral use. You must swallow them before, during, or any time between meals. If your doctor has prescribed a half tablet once or several times a day, half the tablets are described below. The Cordarone tablets has a break line, so you can easily break it into 2 equal halves. To halve the tablet, press down on it with your thumb on its surface. You do not run any particular risk if you occasionally forget a tablet. Do not take a double dose to make up for a forgotten tablet. Contraindications. Sinus bradycardia and sinuatrial heart block in patients with severe conduction disturbances, high-grade TV block, bifascicular or trifascicular block, or sinus node disease. Amiodarone hydrochloride should be used only in conjunction with a pacemaker. Evidence or history of thyroid dysfunction. Thyroid function tests should be performed in all patients prior to therapy. Known hypersensitivity to iodine or to amiodarone or to any of the excipients. 1 200 mg tablet contains approximately 75 mg iodine. The combination of amiodarone hydrochloride with drugs, which may include pregnancy except in exceptional circumstances. Lactation. Warnings and precautions. Amiodarone can cause serious adverse reactions affecting the eyes, heart, lung, liver, thyroid gland, skin and peripheral nervous system. Because these reactions may be delayed, patients on long-term treatment should be carefully supervised and reviewed regularly. As undesirable effects are usually dose-related, the minimum effective maintenance dose should be given. Before surgery, the anesthetist should be informed that the patient is taking amiodarone. Amiodarone may induce peripheral sensory motor neuropathy and/or myopathy. Both these conditions may be severe, or for recovery usually occurs within several months after amiodarone withdrawal, but may sometimes be incomplete. Side effects. Like all medicines, this medicine can cause side effects. Alternatively, everybody gets them. Microdeposits in the protective outer layer of the eye. Corneal microdeposits that can cause vision problems such as cloudy visions or colored halos. Excessive skin reaction to sunlight, photosensitization. Changes in thyroid hormones without any obvious signs of thyroid disease. Increased amount of certain liver enzymes transaminases in the blood. Digestive problems, nausea, vomiting, changes in taste. Common. Gray skin color. Thyroid disease with symptoms such as weight gain, feeling cold and tight, hypothyroidism, or on the contrary, excessive weight loss, hypothyroidism. Serious forms of hypothyroidism can be life-threatening. Lung damage then can be progressed to life-threatening pulmonary fibrosis, pleurisy. Dry cough, shortness of breath, fever or tiredness. If you have any of the symptoms, tell doctor as soon as possible. Extrapyramidal symptoms such as trembling, sleep disorders including nightmares, nerve damage, peripheral neuropathy, acute hepatitis that can be life-threatening, slowed heartbeat. Uncommon, slowed heartbeat and heart rate problems. Although this medicine is used to treat such problems. Muscle damage, myopathy in the arms and legs.